Good day, global citizens. Welcome to another episode of Dr. Fajembola's Opinion. Today we have a good colleague of mine who is one of the authors. I was specific about having a female on this episode to balance the number of male and female guest researchers I bring on board. How are you doing today?
I'm doing fine. How are you too? I'm glad to be here.
I'm good, oh, thanks to God. Today
Question that a lot of people ask me. So I'm going to answer it in two parts, which is the pediatrics bit and the pediatric surgery bit. So
is very fine. Dr. Kelsey, you've experienced, I know we've both, but I feel you have more experience. You've experienced the health systems in Uganda. You got your undergraduate degree from Uganda. You experienced the health systems in Uganda and also yeah. So Gripe water has combinations, and you've seen from earlier one of the tweets we covered where someone is lamenting like Gripe water has 4.4% alcohol, like from what that person was
Mhm.
saying. Why do you feel it's considered as a herbal medication?
Gripe water is considered as a herbal medication because the primary components
Circulation of fake drugs. So make sure you
yeah.
are getting the prescription from the physician and also getting from the right. And if you're a non-Nigerian and there is common use of Greek water in your country, do let us know. But I don't know, maybe because I come from Nigeria and I've absorbed most of a large part of Nigerian culture, I feel we use Greek water more. But according to the tweets, like one of the tweets I read earlier in Pakistan, a mother coming for Mugo and coming with Greek water. So it seems Greek water
the belly, right? And so when there is leakage into that, which is of course it's not meant to be there, so the patient would have pain. They could also have serious infection. Yeah.
Thank you so much for that. On our audience getting what intestinal perforation is, and I know from the paper they were getting different types of. They are seeing different. They were coming across different names or the different parts of the intestine, the jejunum, the duodenum, the ileum, and I just want our audience to know that let's say there are three junctions. Bus A will take you from the first part of the duodenum to the second part of
Mhm.
the duodenum. Then the
Yeah.
second bus, there's a junction there. Then the second bus takes you from the duodenum to the junction of the from the duodenum to the junction of the jejunum. Then the third bus stop from the jejunum to the ileum. So that's what you should know. I'm using it in terms of bus stop because I feel that is how most of us can understand it. There are three bus stops. The first bus stop, the duodenum. The second bus stop, the jejunum. And the last bus stop, the ileum. So these are parts of the intestine. And in this paper, what we are concentrating on is perforation of the last part of the small intestine. It is the ileum. So Nigerian culture, do you feel Nigerians are more excited about drug misuse with regards to condiments like grape water? Do you feel just excited when they have children? Oh yeah, that grape water will be hearing of. Let us use it to go and buy it.
So to some extent, yes, I think so. Because I don't even think most people know the definition of colic, right? Interested in it, or they are not so much aware of what they can use, right? There are always people around to tell them that okay, there is Greek water. Like you said, the example of that grandparent. So yeah, we are surrounded with people who don't know much
In terms of antibiotics, and I'm trying to extend that light on how we as Nigerians And also low and middle income countries, especially countries like Nigeria, like to misuse drug, extending it to drugs like Gripe water because we have access to it, because we have a child or because we've acquired knowledge of utilizing it, or maybe a neighbor as a child has used it, like
that this is something that would resolve as time goes on, right? I think the average of it resolving is around 3 to 4 months, and also knowing that it is self-limiting. So the first thing I always say is you start with the breastfeeding. You have to ensure that your child is latching properly on the breast. So there is no air transferred, like they don't swallow a lot of air, right? And then also if you notice, yeah, the baby is crying so much, you'd ensure that you're giving them small but more frequent feeds, right? So that's another thing, you do small, more frequent feeds. And then the go-to is upright positioning and burping after feeding, which allows them to, swallow the air, which is so many people's nightmare. Like in the people who have been exposed to steroids, indomethacin, or even prematurity. So yeah, it's a no, especially for those ones. Generally, it is a no. Now, especially for those neonates, it's a total no. And if at all, in as much as you say what you say, people would still take Greek water. That's Greek water rather. And yeah, if you be taking it, just like Dr. Aziza has been saying, they should see a medical doctor. They should be assessed, evaluated, and then reviewed, obviously, before giving their child Greek water.